Hi, everyone. We're going to get started with our webinar for tonight. So on behalf of the Society of Interventional Radiology Medical Student Council, I would like to thank everyone for tuning in for the first annual Society of Interventional Radiology Medical Student Council business meeting. At this webinar, we will discuss who we are, what we do, and also talk about the application process to join the Student Council. My name is Lauren Park. I'm a third-year medical student at Brown and the incoming chair of the Medical Student Council. Just a brief overview of our program for the webinar. First, I will discuss the council structures and the recent changes in leadership. Then I will introduce all of the MSC Governing Council members, including our faculty and resident advisors. Then after that, for majority of our webinar, each chair will discuss the achievements from the past and the goals for the coming year, including specific projects under each committee. This will be particularly of interest for those who are interested in signing up for MSC membership for the first time to understand not only what each committees are doing, but also what kind of projects that they are working on currently. After all the committee chairs discuss their agenda, we will provide an overview of the application and also give you guys advice for a strong application. We are growing tremendously every year, and the application process is becoming more competitive. So I would highly encourage all of you to stay tuned for the application advice section. Last but not least, we will end with a Q&A session, but you guys are more than welcome to ask any questions throughout the night, throughout the webinar. And either Erin, who's our vice chair, or Rebecca, our outgoing chair, will be answering you guys in private messaging. So just a couple of webinar rules. We will mute all of the panelists' mics throughout the webinar to minimize background noise. So please type into the chat box if you have any questions or comments. Please select SIR staff from the chat box drop-down menu to submit the questions. If you do not select an individual, any questions you ask will be visible to all other attendees. Everything that is discussed during the webinar will be recorded. If there is any part of the webinar that is inappropriate or irrelevant to the discussion, it will be removed from the webinar before it is publicly posted. Thank you in advance for your cooperation. All right, so we will continue with our agenda for tonight. So the mission of the Medical Student Council follows the mission of the Society of Interventional Radiology Resident and Fellow Section, also known as RFS. We promote the clinical model of IR practice to trainees and medical students who are passionate about the future of IR. With the help of our advisors, we strive to become disease experts, focusing on patient-centered care. With all of your help, we strive to propel interventional radiology to the forefront of clinical medicine and patient care. Just to give you guys a brief history, Medical Student Council has really come a long way. First of all, RFS was started in 2009 by Dr. Vatican Cherry, our student and resident council advisor, with students who are also with residents who also believed in expanding clinical aspect of IR. The group of residents then worked with the Graduate Medical Education Council to create RFS. MSC grew out of RFS around 2012. The primary goal of MSC was to raise awareness about IR via interest groups, which then expanded to medical student IR symposia. Since then, MSC has grown into 6 subcommittees that is utilizing different means to raise awareness about IR via different topics and platforms, whether through blog posts, social media, educational resources on YouTube, research resources, and as of 2 years ago, via humanism and also BIODESIGN. So this is the MSC structure. The governing council is overseen by the MSC chair and vice chair under the supervision of resident and faculty advisors. The governing council includes chairs who lead each of the committees, including BIODESIGN and Innovation, Education, IR Interest Group, Patient and Family-Centered Care, Research, Public Relations and Communications, and webmasters. With the growth of MSC, we decided to separate Education and Research Committee into their own distinct committees this year. Used to be Research and Education as a one committee. Each of these committees have a range of 10 to 20 medical student executive council members who work on projects under the umbrella of each of these committees. Students work directly with their committee chairs, and the chairs meet once a month to update each other on projects and discuss potential collaborations. This year, we decided to expand on medical student membership, also with medical student reserve. Students who are signed up for the reserve will be able to assist on short-term, at least for 1 month, short-term projects. As medical students, we understand our schedules, when we have free time to work on project, and when we are too busy to be an active participant on MSC. So we thought this would allow students to maximize their time to really be part of a great project and make a great impact on MSC. We will discuss the application process for the reserve in detail at the end of our webinar. I will now briefly introduce our outgoing and incoming chairs of each of the committees. So again, my name is Lauren Park. I'm a third-year medical student at Brown and the incoming chair of the Medical Student Council. Aaron McBride is a fourth-year medical student at Cleveland Clinic, currently taking a research year, and he is an incoming vice chair of the Student Council. I have a big shoe to fill. Following the outgoing Student Council Chair, Rebecca Lee, fourth-year medical student at Florida International University. Rebecca did a tremendous job this year, very evident with the growth of the Student Council itself. She has exceeded the goals for the council with every committee and was a strong advocate for the students. Under her advocacy, we were able to host our first medical student business meeting tonight. So we are very grateful for her leadership, and we're lucky to keep her at our side as our resident advisor for the next year. We're also grateful to have Drs. Vaticancherry and Rochon as advisors. Dr. Vaticancherry is our wonderful faculty advisor who oversees our projects and guides our overarching goals to align with SIR. Dr. Rochon is the faculty advisor of STARC, which is Student and Resident Committee within SIR. He is a tremendous mentor for us as well. We also have resident mentors. This year, Dr. David Maldo is the incoming chair of Resident Fellow Section, and Dr. Andrew Niekamp is an outgoing chair. David and I are working to really collaborate between the resident and the medical students this year so that students may have the opportunities to work more closely with the residents as well. The outgoing governing council are as follows. Kyle Wilson was our MSC chair for 2016 to 2017 and was our resident chair this year. Rebecca Lee was the chair, is an outgoing chair. Ethan Ungchuzi was the chair of BIODESIGN and Innovation. Hector Bant was the chair of Education and Research. Bill Zhu was the chair of IR Interest Group. Vishal Sinha was the chair of Patient Family-Centered Care. And I was the chair of PR and Communications. And our webmasters were Hanson Lee and Eric Keller. They were an incredible team of leaders who really helped the MSC to grow this year. The incoming chairs are as follows. BIODESIGN and Innovation will be led by Jessica Yoon. Education Committee will be led by Sana Harwal. IR Interest Group will be led by Ricky Korf. Patient Family-Centered Care will be led by Colton Welch. PR and Communications will be led by Chris Zinsmeister. Research will be led by Leanne Duminy. And webmaster will continue to be the amazing Hanson Lee. The incoming chairs will be presenting on behalf of their committees tonight. The key accomplishments from this year is very clear, especially with the numbers from our growth. We had 31% increase in medical student membership within SIR, as you can see on this graph, and 27% growth in the number of IRIGs and 60% growth in the number of medical student IR symposia nationwide. We expanded the committees in MSC to include BIODESIGN and innovation. For the coming year, we separated education and research committees. We added MSC reserves and added the vice chair position to our governing council. In addition, in terms of grant funding, we added 35 more student in training scholarships for the students to attend this year's SIR conference in LA. Last but not least, Hansen, with Eric's help, we reconstructed many parts of our website to optimize user flow. So we would like to sincerely thank those who are involved in 2017 and 2018 MSC Governing Council, of course, our RFS and STARC members, as well as SIR for contributing to these efforts. So to discuss this year's initiatives, for recruitment, we plan to continue expanding our medical student membership with a goal of 2,300 members. We hope to see more students register for SIR 2019 with the goal of 425 students registering. We hope to provide support for expansion of IR interest groups, especially helping to start new IRIGs at institutions without strong IR mentors or departments. We will also encourage collaboration between regional IR interest groups to host more regional symposia than individual institutional ones to combine forces. We have revised the MSC membership and committees as mentioned. Last but not least, as medical students are now applying directly into IR residency, we believe strongly that we need to reach out to undergraduate students to help them get involved early and also build their passion to strive to become a great IR in the future. As a chair, I will also continue to emphasize collaborations with attendings from STARC as well as residents from RFS, especially on expanding social media for education and recruitment. We would like to strengthen educational resources for the medical student education so that MSC can be the go-to resource for medical students seeking information about IR. The topics we will focus in terms of the clinical IR training for all the committees will be on stroke care, deep vein thrombosis, critical limb ischemia, and wound care. Last but not least, as SIR is expanding women in IR initiatives, we will strive to focus on growing advocacy as well as awareness of women in IR as well. All right, that's all I have prepared as a chair. Our first committee chair to present will be Jessica Yoon with BIODESIGN and Innovation.
Okay, thank you, Lauren. I'm really excited to be here talking about BIODESIGN and Innovation. Like Lauren said, this was a new committee this year led by Ethan Andruzzi, and I'm really excited to talk about what we've accomplished. So next slide, please. Thank you. So our mission statement really was something that our committee has worked hard on this year to develop. We wanted to highlight the uniqueness of interventional radiology as a specialty and encompassing these innovative ideas as a field. So the BIODESIGN and Innovation Committee really wanted to expose medical students and trainees to the idea of biodesign, what that process looks like and how to start thinking about processes and problems in a biodesign way, to educate students on the basics of how to go about this and thinking like an innovator. We wanted to provide challenges for students and trainees to test their ability to think about solving clinical problems with this unique biodesign mindset, and also to collaborate with attendings, residents, and other students who are really interested in biodesign and interventional radiology. Next slide, please. Thank you. So what we've accomplished this year, we're really excited to say that we have got a medical student hackathon under our belt, the theme this year was end-stage renal disease and how interventional radiology can really improve the quality of care delivered through management, procedural, procedurally related treatments to ESRD or to minimize treatment complications and procedure complications. So for this, we had 17 attendings that were involved in helping us formulate the theme and provide feedback to the student teams. 6 teams participated from all over the country. We had a collaboration with Sling Health, which is essentially a kind of a medical student incubator company that helps students bring their ideas to market, excuse me, and we had the participation of one industry representative who gave some great outside feedback. So we had a judging webinar, as I've mentioned, with 2 of the top teams. And one team has decided, excitingly, to pursue their project. So we can't wait to see what they do and where they go from here. We've also hosted a couple webinars, Where Good Ideas Come From, with Dr. Kieran Murphy. Please, if you get a chance to check it out. It was a great webinar listed on the SIR, the MSC YouTube site, I believe. We also had a Fundamentals of BioDesign webinar with Alex Morrison from Sling Health, kind of teaching us and other medical students about the biodesign process. And an upcoming webinar is kind of a plug for anyone interested. It's on intellectual property protection of medical devices, specifically geared towards medical students and early trainees, and that will be with a patent lawyer. So that's on March 1st, if anyone would like to attend. Next slide, please. Okay, great. So what we hope to accomplish moving forward, we really want to make this hackathon an annual tradition. So our goal in the next 2 to 3 months is to gain feedback from the student participants and the attendings to really improve and refine the program, that we could host it every year pretty flawlessly. Our specific goals are to have at least 10 IRAG teams, 15 attending participants and industry representative, and have a presentation with the top 3 teams. We would also like to host a regular webinar series featuring interventional radiologists who have experience and expertise in the design field, innovators and experts in product development, hopefully some from industry as well. And topics are, as you can see, varied. So we are hoping to have a very interesting and unique set of webinars that you can all learn from, and not just on the clinical side of product development, but also industry side. Next slide. We are also hoping to create a curriculum for medical student symposia. Like Lauren mentioned, the number of medical student symposia has gone up in the last year, which is really exciting. And we're hoping to make biodesign and innovation a more regular part of those symposia. So this past year, we started working on a sort of plug and play curricula. We would ideally love to have a student either from interest groups or our own committee present and educate other medical students at these symposia. And our first symposium is the Midwest IR Symposium in May 2018, so hope to see some of you there. We would also like to collaborate with the PR and CC quarterly newsletter to provide articles highlighting new devices and technologies, interviews with experts in the field, and even some student highlights student research that they feel comfortable sharing, and some exciting things going on there. We would also like to work with Hanson and the website to build out a kind of resource page for students who are interested in any of these biodesign related topics, to find information on how to get started, or information about Sling Health, resources to kind of take their ideas to the next level. Next slide, please. So great. If you have any questions or comments, or are interested in applying to biodesign and innovation, we would love to hear from you. You can see our email on the slide. Please email us there. And that's all that I have. Thank you so much.
Thank you for the updates, Jessica. Next, we will hear from Sana for the Education Committee.
Can you hear me?
Yep, we can hear you.
All right. Thank you, Lauren. So I'm Sana. I'm the incoming chair for the Education Committee. I owe a big thanks to Hector Banks, who was the previous chair of the Education and Research Committee. So as Lauren explained, that committee broke up into these two new committees this year, and I'm really excited to talk to you about what we have done on the education side of things and what we have planned for the next year. Next slide, please. All right, so the mission of the Education Committee is to create and publish educational materials about interventional radiology that are accurate, useful, and accessible to medical students. As Lauren was saying, the goal really is to have the MSC be the central resource for providing educational resources to medical students who want to learn more about IR. It's not always a standard part of the curriculum, and we want to make sure that medical students are able to find the resources they're looking for. So there are three subcommittees this upcoming year that are part of the Education Committee. And each of these subcommittees is focused on one particular project. So we have the IR Presentation Subcommittee, the IR Video Subcommittee, and the Sound of IR Podcast Subcommittee. Two of these are new this year, but before I start talking about what the goal of these different subcommittees are for the upcoming year, I'd like to talk about what was done on the education side of the Education and Research Committee this past year. Next slide, please. So one of the subcommittees from this past year was the Video Subcommittee. So if you go to the YouTube address that you see on your screen, you can see some of the videos that were produced by this subcommittee. Also, if you search medical student IR videos on YouTube, that should also bring it up. And so there are 6 new videos that were produced since SIR 2017. And these run topics such as, excuse me, tips for portal hypertension or uterine fibroid embolization, PICC line placement, procedures that are very commonly done that we think medical students would like to be exposed to before they see it with their own eyes in the IR suite. And this video subcommittee was also responsible for producing the program director webinar, which was done late in the summer and had almost 200 attendees. So we're looking forward to having another version of that this year. And additionally, the education part of the Education and Research Committee produced the Intro to IR series. So this is a bunch of short chapters that are in their own Word documents. And you can see on the bottom right of your screen, some of those topics are listed. So if you go to the MSC website and go to Explore Interventional Radiology, you'll see the Intro to IR chapters listed there. So this is really geared for medical students who want very focused educational resources on a particular topic. And I invite you to take a look. We're very excited to have been one of the many years of students who've worked on this project and finally completed it. Next slide, please. So first subcommittee I'm going to talk about is the Video Subcommittee. So the purpose of this committee is, not surprisingly, to create and publish videos. And the idea is that these videos would provide a quick but thorough preview of an IR procedure that a medical student might see. And so you can check out the website that was on the previous slide to see some of these videos from before. And at least when I first heard about this project, I was a little intimidated by the prospect of making videos. But I really invite you, if you're interested, to consider joining the subcommittee and joining this project, because there's been some really good instruction done by the previous subcommittee chair, that was Wilfred Manzano. So the annual goal is that each member of this subcommittee during the year would draft a script of what the voiceover is going to be for the video, and the script would be reviewed by faculty. We want to make sure that, we're medical students, we're still in training. We want to make sure that everything we produce is as accurate as we can make it. And then we create slides that correspond to what you want to say and how you want to show it. And then we record it and make that video. And then once everything looks the way that you want it to be, then we can publish it on YouTube and help share your perspective, help make it easier for the next medical student who wants to learn about your favorite topic in IR. And so the goal is to, for each member of this subcommittee to make one video per member per year. If you want to go crazy, we don't mind that either. And so you can see below some examples of videos that have been previously made, like UC and tips. Next slide, please. A new subcommittee that is starting this year that I'm excited about is IR presentations. So the goal of this subcommittee is to create presentation slides that will help with the education of preclinical medical students and educate and expose these students to IR. So this would be, for example, in the setting of an IR interest group meeting. And so this, we do have slides that are in a similar vein. If you look on the Explore IR webpage, you'll see the Med Student Lecture Series. This is more geared towards clinical medical students. It's more of a clinical presentation of situations where IR might be involved in a patient's care. But we really wanted to gear these slides so that they would really be accessible to a preclinical medical student who hasn't necessarily spent a lot of time in the hospital yet, but still has an understanding of basic pathophysiology and anatomy. And we think that it could be actually very helpful to discuss those things that the medical students we're all learning during second year, and which could provide a transition both to learning about IR and sort of transitioning into the more clinical aspect of things. So the goal would really be to produce these accessible slides that would sort of bridge the gap between the preclinical and clinical years, focusing on IR because we're everywhere, we're in every organ system. So the goal for this subcommittee would be to, for each member to produce 2 finalized presentation slide sets per member per year. And again, these would just be run by faculty or somebody with background knowledge to make sure that we're all on the same page. Next slide, please. And then finally, another new subcommittee this year is the Sound of IR podcast. So the goal of this committee, not surprisingly, is to create an educational podcast. And we want these podcasts to be relevant to the current practice of IR, but still accessible, ideally, to a preclinical medical student. And we had 2 basic formats in mind for these podcasts. One was that they could be in the form of a monologue, and this would again be reviewed by an attending just to review for accuracy, or maybe they have additional suggestions or comments. And this could be discussing recent research. This could be discussing a particular type of procedure. So for example, uterine fibroid embolization. How would you go through it? What are the steps? What are the complications? That would be an example of a monologue. Or alternatively, this could be an interview of an IR attending. This could be someone at your local institution or someone who's across the country. We're really working to make it so that a member of the subcommittee could interview an IR attending across the country. And the way that this would work is that a student would prepare questions ahead of time and then interview the attending, and then that interview would be the content of the podcast episode. And just as a quick note, this podcast exists separately from the subcommittee as well. So we've also been collaborating with members of the RFS who have been really excellent at joining in this podcast project and helping us to create episodes. So the annual goal for members of the podcast subcommittee would be that each member would either draft a script, if this were for a monologue, and get that script reviewed by a faculty member, or would draft interview questions that would be reviewed by the subcommittee and by the interviewee, and then finally to record the scripted audio for a monologue, or to interview the faculty member, and that interview would be recorded. And so the goal would be 2 recording sessions per member per year, so that would be drafting the script or interview questions and then recording that. Alternatively, if somebody's very interested in writing and not recording, please feel free to reach out to me and I'm sure we can work something out as well. Next slide, please. So if you're interested in creating educational resources and helping to make it easier for each year of medical students that comes across that's interested in IR, please consider joining the Education Committee. So if you have any questions or comments, feel free to reach out to me at that email address there. Thanks.
Thank you, Sana. Next, Ricky will be presenting on behalf of IR Interest Group Committee.
Hey everyone, my name's Ricky Korf and I'm the incoming IR Interest Group Committee Chair. Our outgoing chair, Bill, has done a fantastic job leading our group this year, and I'm excited to tell you about our committee and what we've been working on. Next slide, please. The mission of the IRIG committee is to promote medical student interest and involvement in the field of IR by supporting the activities of IR interest groups, including local school-based efforts as well as larger regional symposia. Next slide. So with the advent of the new IRDR residency, it's important more now than ever to ensure that medical students are exposed to the field as early as possible. And medical student IR interest groups are a truly effective way to achieve this goal. So as you heard before, this year we've seen a 25% increase in IRIGs and combined diagnostic and interventional radiology interest groups registered with SIR, bringing us to a total of 84 IR interest groups, which has surpassed our stretch goal of 80. And in addition, we've seen a 27% growth in overall interest groups, and this figure includes both the diagnostic radiology and IR interest groups in our SIR database. And as you can see from the graphs, the most growth has actually come from an increase in standalone IR interest groups. Next slide, please. So like IR interest groups, medical student IR symposia have been essential in introducing students to the field of IR through lectures from esteemed faculty and hands-on activity. We've seen a huge jump in the number of regional student symposia this year, especially in the South and Midwest. 24 symposia have been held since SIR 2017, which represents a 60% increase from last year, and we've far surpassed our goal of 16. Next slide, please. Over the past year, the IRIG committee has worked on 3 main projects. The first of these projects revolves around IRIG tracking and resource development. In order to keep track of IRIG growth over time, we send out a yearly survey to medical schools to collect information about IR interest group activity there. In this way, we can keep an up-to-date database of interest groups and their contact information. In addition, our committee maintains an IRIG roadmap, which is a wonderful written resource that contains helpful tips for creating and growing an IR interest group. The second project is symposium tracking and resource development. One of our important ongoing ventures is our symposium survey project. Throughout the year, we've been working with IR symposia organizers to collect data from students who attend these events in order to assess their effectiveness and look for areas for improvement. In addition, in parallel to our IRIG roadmap, we maintain a symposium cookbook with tips on how to plan a medical student IR symposium. This year, we've made some significant additions to the content, and the most up-to-date version will be published on the SIR RFS website shortly. And lastly, we've developed a new page on the website which highlights successful IR symposia across the country. And the third project is our online map-based database. On the medical student section of the SIR RFS website, you can find a list of all upcoming regional IR symposia and IR interest groups across the country, organized by location. Next slide, please. For the upcoming year, we have 2 major goals. The first one is to better assist with IRIG creation and growth. In the upcoming year, we want to provide more personalized guidance on creating new IRIGs, as well as add to our IRIG roadmap document with more detailed advice and ideas for events. In addition, this year we'll be working on developing a virtual IR interest group for students at institutions without IR faculty or residents. We'll also improve our effort to connect these students to nearby IR events. Our second goal for this year is to improve communication with IRIGs. Members of the MSC IRIG committee will have regular contact with leaders of local IR interest groups throughout the year. And this will help our committee to assist with any challenges faced and to track and highlight unique IR events hosted by IRIGs on our website and social media. Next slide, please. And lastly, here are the quantitative goals our committee aims to reach by the SIR annual meeting in 2019. We'd like to have 95 IRIGs and combined RIG-IRIGs registered in our database. For our communication goal, we're aiming to have regular check-ins with 40% of IRIGs. And to improve our IRIG roadmap, we hope to have 2 new sections by next year. And in addition, we aim to develop a virtual IRIG curriculum with at least 1 online event per month. For our symposium-related goals, we'd like to see 25 student IR symposia before next year's annual meeting. We also want to facilitate improved collaboration between schools and have 35% of IRIGs either host or co-host a symposium. Our committee also aims to expand upon our symposium survey project and collect data from students at 8 regional IR medical student symposia this year. And last but not least, we aim to publish 4 symposium highlight articles to emphasize all the great work medical students are doing throughout the country to promote the specialty of IR. Thanks for listening, and I hope you apply to join the IR Interest Group Committee.
Thank you for the update, Ricky. Now we will hand over to Colton, who will be presenting on behalf of Patient and Family-Centered Care Committee.
Hi everyone, this is Colton. I'm the incoming chair for the PFCC, and I'm taking over for Vishal, who did a really amazing job with the PFCC last year. And I have some pretty big shoes to fill, but I'm looking forward to keeping up the work he's been doing. Next slide, please. So as IR becomes a more independent and patient-centered medical specialty, the PFCC seeks to serve as a resource for both patients who are navigating the field of IR for the first time, as well as medical students who are considering IR as a specialty. And the PFCC seeks to empower patients and their families by providing educational materials that are related to the patient experience in IR across a variety of different procedures. So one thing that we really find with patients in IR is that they've never heard of IR, and that gives them a lot of anxiety sort of going into procedures about what's actually happening. So we really primarily want to be a resource for those patients and give them access to materials that can teach them about interventional procedures. And additionally, the PFCC seeks to better inform medical students about the shifting paradigm of IR as a patient-centered medical specialty. So next slide, please. And so some of the projects we've been working on, most recently, just last week, we had a patient-centered care webinar. And this was in conjunction with the UCSF Introduction to IR webinar series, which was led by Dr. Vishal Kumar at UCSF. And we had 5 attendings present from a variety of institutions. And this was really an opportunity for students to hear from different attendings about what patient care looks like in their practice in a variety of settings. And the main projects that we work on, or that we've been working on, are the patient narratives. And the patient narratives are really our primary resource for patients. And what these are interviews with patients who have undergone a variety of different procedures. And it's really a way for patients who are new to IR, who are coming into it for the first time, to hear from other patients about what their experience was like, what their outcomes were like, about any anxieties that they had going into the procedure. And just to sort of get an idea from other patients who have been in their shoes about what their experience was like. So we've completed narratives for UFI, for AVM and HHT, and for abscess biopsy and drainage. And we have several more in the works. And another project that we just started up are the patient-centered care videos. And this is in collaboration with the RFS. And basically what these are just a video version of the patient narratives. So again, we find patients who have undergone IR procedures, and we interview them and we get in their own words sort of what their experience was with IR, any concerns they had going into it, how they felt about it. And it's really just a way for patients to see from other patients who have gone through the process about what IR was like. And so we have 2 completed, and we're working on the 3rd. And in addition to those resources, one of our members wrote an article about research in patient care with Dr. Dan Brown at Vanderbilt, and another article about conscious sedation. So that's what we've been working on over the past year. Next slide, please. And for upcoming projects, one of the main goals for next year is to expand the patient-centered care videos. So after we complete the pilot videos, we really want to launch that in full and get videos from a variety of different procedures. And similarly for the patient narratives, we also want to expand that. And our ultimate goal with the patient narratives is to have at least one for every procedure that's routinely done in IR, so that any patient coming into a procedure can find a patient who's gone through their experience, can hear from them about what it was like, and can sort of use that as a resource to learn about their procedure. We also want to work on some articles on specialty tribalism and interactions with other medical specialties. So how does IR interact with other medical specialties? Where does IR fit sort of in the grand scheme of a patient's healthcare? And we also want to start up some podcasts related to patient care in IR. Next slide, please. And again, sort of our broad goals are split up into 2 categories. So firstly, we want to expand the library of patient narratives and patient-centered care videos and really expand the access that patients have to resources about their procedures. And as I sort of stated before, we want any patient coming in for any procedure in IR to be able to go to this library and find a video or an article that's by another patient who went through that and get from a patient's own words what their experience was like. And we also want to expand the library of resources for medical students and trainees. So whether that's more webinars related to patient care, sort of the role of the IR resident in patient care, or the role of IR as part of a patient's overall healthcare. And that's it. Thank you. Oh, and if you have any questions, feel free to get in contact with me, and I can give you more information.
Great, and you can reach Colton by emailing us at sir.students@gmail.com. Thank you, Colton. So as an outgoing chair of PR and communications, I will be presenting on behalf of Chris for our committee. The goal of PR and Communications Committee is to provide useful, educational, and exciting content that serves to inform and attract medical students to the field of interventional radiology. Overall, we are responsible for the content on the MSC blog, as well as the contents on our various social media, including Facebook, Twitter, and Instagram. If you are not following our social media, please follow us at SIRRFS, and also check out our websites for our previous blog posts. So this year, we published 12 quality blog posts, all carefully peer-reviewed internally. We covered topics from tips from recent IR applicants, overview of nanoblock and therapeutic ultrasound in IR, the impact of virtual reality in IR education, also the feedback on SIR 2017 and students' experience, as well as many more on our blog. If you check out our website, we'll have contents from the common things that you'll be pimped on at your IR rotations to how to succeed in radiology elective. We continued to expand and worked on contents for social media. We also published a pilot episode of the very first SIR MSC podcast, which you can listen to on our website. We will continue to collaborate with Education Committee, as Sana has mentioned, to expand on the podcast project, which is now called Sound of IR. We will continue to collaborate, with, and the member of our committee also collaborated with SARC and RFS to make a screening guide for a documentary film titled Without a Scalpel about IR. Last but not least, we hosted a webinar. We hosted a webinar about navigating BSAS and away rotations, which was well attended by about 75 students. And we will have a follow-up blog post summarizing the Q&A sessions, some of the advice that we received from the program directors on the panel. So our main project is definitely producing a quality blog post on our website, as well as participating in RFS quarterly newsletter. We really strive to answer the questions that students would like to know about IR and succeeding in IR as an IR applicant. So we're going to also continue to expand that effort onto social media, especially on Instagram and different online platforms such as Student Doctor Network, Reddit, and on Mini, to facilitate discussion and also share the information that we have, whether it be on our blog or something that we've discussed on SIR. So our goals for the coming year will be to write, again, quality, up-to-date articles about topics pertinent to students. We write about current topics in IR, succeeding in rotations, preparing for applications and interviews, and much more. Really, we listen to our members' ideas and expand on that together as a committee. And our really big goals for the coming year is really strengthening our social media campaign, especially Instagram. This effort is based on the preliminary results of a survey of medical students, which showed that majority of students use Instagram instead of Twitter as social media, as main social media platform. So if you're interested in writing and or creating fun content on social media, please sign up for PR and communications. And if you have any questions, feel free to email us directly on sir.msc.prcc@gmail.com. Thank you, and that's it for me. All right, now on to Leanne for the research committee. Leanne? Sorry, I think she was having some technical difficulties with her mic earlier. We'll just give her a minute.
Yes, hello. Can you hear me now?
Great. Yeah, we can hear you. Thank you for trying. Are you calling in with your phone now?
Yes, sorry about that.
Great. No problem. Thank you so much. So take it away.
So as she said, my name is Leanne. I am the new research chair for the newly formed committee. As was mentioned, it was separated from education and research, and I'll be filling the shoes of director. Next slide. So the main goal of this committee is to be able to teach you all how to best engage in research. We want to do anything to be able to develop the future of the physician scientist in IR. And our goal is to be able to contribute to the progression of IR as a field, which will also improve patient care. We hope to be able to teach all of the trainees about the different forms of research as well, basic research, clinical research, and translational research, since all of these are really needed to be able to push forward any medical field in research. Next slide. So I'm going to discuss some of the projects that we have done and will continue to do for the next year. So first is we summarize the literature. We know that medical students are very busy and some aren't as familiar with clinical and research terms as others. And so our main goal is to be able to summarize the important findings of recent IR literature for you all. You can see some examples in the lower right of some articles we've done in the last year. And so our goal is to continue to be able to do that for all of the trainees. Next is mentorship with research. So one initiative we've done is do a physician scientist spotlight, hopefully providing you all with an idea with what it's like to be a physician scientist in IR, and hopefully demystify that for you. We also, our goal is to provide as many resources on the website as possible. For example, we have a research cookbook. You can see one of our chapters is the how-to series, Biostatistics for the New Investigator. So through this cookbook, we hope to help you to engage in your own research projects. We also have a list of research programs that we have comprised. And this is for those of you who want that full research experience to help you understand what it's like to engage in research in full time, possibly for an academic research career in the future. Next slide. So our goal for the next year, as I've said, is to continue these projects, hopefully to develop them further and provide more materials for everyone. And we also want to have new ideas. So we want to hear everyone's feedback on what you think you need to be able to engage fully in IR research. Even if you're not a member of this committee, we still want to hear your ideas, since we want to help as many trainees as possible be involved and engaged in IR research. One thing in particular for next year, as was mentioned earlier, the importance of social media. I'm looking for a social media representative for our committee, since we want to be able to reach as many students as possible with these materials, and hopefully several trainees can benefit from them. And that's all. Thank you so much for listening.
All right, thank you, Leanne. So now, Rebecca Lee, the outgoing MSC Chair and incoming Resident Chair, will discuss the MSC application timeline and give you advice on a successful MSC application. Rebecca?
Thanks, Lauren, for the introduction. So, hi guys, I'm Rebecca, the outgoing MSC Chair, and I want to thank you guys all for staying for the webinar and kind of hearing more about MSC and who we are. And so I'm going to walk you, well, not walk you guys, but I'm going to just talk about the application process, the timeline, and basically tips for a good application. Next slide. Okay. So our application timeline, traditionally we will open the application around the annual meeting. This year we're opening it a little bit early. We're actually opening it in March, but we're a little bit ahead of schedule. So we're going to open the application sometime tomorrow, and it's going to be live on SIR's RFS's website. So it's don't rush yet, because it's going to be available tomorrow, someday throughout the day, and you'll be able to apply for the Medical Student Council. And you'll have from tomorrow until March 31st to complete an application. We're making sure that you actually will be able to edit the submission after you apply, so you guys don't have to worry about making your application super, super perfect. You can just make the application and take your time and submit by the 31st, and there should be no issues. Our application deadline is very strict. It is March 31st at 11:59 p.m. Eastern Standard Time, after which we won't necessarily accept applications for the council next year. In the month of April, we are going to be, all of the chairs and I will be reviewing the applications. Each application is read and evaluated by all governing council members, and we try to figure out what areas would be the right fit for you based on the application that you send to us. And on May 1st, our decisions will be finalized, and we will send everyone an email. You should expect an email on May 1st from SIR students. If you do not get an email that day, please reach out to us. I know sometimes emails get lost, but you will get an email from us saying that you've been accepted to our the council or the reserve, an RFS service line, or your application is currently unassigned, just because there's so many people. Next slide. So a couple of tips for a successful application. On our application is basically what we're looking for. We're looking for very succinct but high quality answers. We really want to get to know you from your application, and it can be really hard to do that. It can be hard to do that. So that's why I'll give you guys some examples after this. We're looking for you to detail the relevance of your achievements or your leaderships or anything that you've done previously before the council, and we would really like to see any local or regional efforts that you've developed in IRIG. I think it's really important from the national level to see that students who are coming to Medical Student Council have been working locally or regionally to expand IR. And it's not a requirement, but it's strongly encouraged if you've tried to do that, and it's strongly encouraged to mention that in your application. We also recommend providing tangible deliverables like a portfolio if you have photography or writing skills, or a website link if you have if you're interested in web design, so we can see your coding skills. Essentially, the reason why I mentioned this is it's a really good way for us to see what you've done and kind of show your work and let your work speak for yourself. From a personal level, I do photography, and I actually put my website in my ERAS application this year when I applied for residency. And it was actually great to talk to a lot of interviewers because they mentioned that and they actually looked at my website. And so it's just a good way, not for us to get to know you as an applicant, but also to see like what you've done. And there's a lot of tangible information that you can get from things that don't necessarily, things that aren't necessarily written in essay format. And the last suggestion that we have is for any proposed idea that you do have for the council to provide a timeline or detailed plan of how you would see this project happening within a calendar year, or providing any alternative ideas for a proposed idea, if applicable, would be great. So I'm sure that's basically what we're looking for. Is we're just looking for, we really do want to get to know you in the application. We want to see what you got, and we also want to see what you can bring to the council. And these are just a few of the ways that I would recommend going about writing your answers, or kind of showing us what you can provide. Next slide. But in case if that wasn't straightforward, I actually have a few successful applications from the previous year. These applicants had applied for the Medical Student Council last year, and I picked them out because I thought that some of the examples that they provided were probably most helpful for people who are applying for the council this year. So Lauren, not next slide, but just click. So, and click again. Okay, so on the left, we have an application for previous leadership experience. What I really liked about this example was not only the example was really detailed in terms of what the student did. He mentioned not only his involvement with his local IRIG and talking about the event and how many people actually came to his event, but he also talked about his experiences as an undergraduate and detailed what he did. In this example, he said he was the VP of technology, he designed a website, he also talked about his TA experiences and what he did as a TA. My only suggestion for this, which would have been really awesome, is if he put his website for the club. That would be really nice to see. But it's totally fine. I think that this was still a really great, it's a really good example of describing your leadership experiences and how they could be relevant to to the Medical Student Council. And then on the right, we have another one. And then Lauren, just click a couple of times. Okay, one more time. Okay, one more time. Awesome. So this next example that was provided for us, I really liked this example just because the student who wrote this application, who wrote this answer, she was very explicit in terms of what she did when she was working at this job at the United Community Clinics. She specifically talked about grant funding, and she talked about how much she made, which was important objectively, and also gave us examples of what she actually did, including design curriculum presentations and conducting group and individual skills training. What I really got out of this about this applicant was that she's really used to having a lot of different roles. She could be very flexible and, she's definitely a team leader, and she's open to trying different things in leadership, which I think those are really important things to have in leadership. I think successful people in MSC, they aren't, we're not necessarily looking for someone who's a coding master or someone who's the expert at whatever X, Y, or Z. We're looking for people who are team leaders, who are willing to be part of a collaborative effort and help out the group, but are also willing to push themselves, out of their comfort zone sometimes and try new things for the sake of the group. I think those people end up doing really well at MSC, and I would like to think I was one of those people. Hopefully, in return, you not only get a great experience being on the council, but you also get to grow as a leader and develop professionally and personally as well. Okay. And I also wanted to show these two examples because I'm showing you that they're actually quite succinct answers. The second answer on the right kind of goes on a little bit longer, and that's totally fine. If you want to write more, you're more than welcome to. But I also just want to prove the point that we do want to respect your time as well. We know that you all are medical students, everyone has a lot of work to do, and they have a lot of deadlines and other requirements for class. And so, if you feel like a paragraph is not a lot, it actually can be a lot for the application. So, so we're cool with succinct answers. We're also okay with long answers, but I'm just trying to prove a point that succinct answers are great too. Next slide. Okay. All right. And then, so these two examples are just, these two answers are answers for questions that we do have related to the application. We do ask applicants to write or propose an idea or expand on a project idea for whatever interest group they're, or whatever committee they're interested in. So I have two examples for you all. On the left, it's for the IRIG committee. What I really liked about this example is that the person that wrote this answer, she went through our website and she looked at our resources, right, that we currently had, and she expanded on it. And what I think is really great about, what I really appreciate about this answer is that she did look at our website and try to go through and see what we had and get a sense of the council. I do understand that it can be hard to do that. As an applicant, it can be hard to figure out like what the society is all about and what the council is all about. But I will say that from someone who does read these applications, that it does mean a lot when someone is able to recall something from the website and like figure out an idea from that. And so we do take that into consideration when we look at applications. This is just an example of expanding on the website, and she provided an example from her local IRIG institution and talked about what she did and how it was effective and how she would like to see that implemented nationally, which I thought was excellent. And I also like that she put her website, so that gave me an idea to learn a little bit more about the person and also the application as well, and actually let me see objectively what was she talking about in her application. And then on the next on the right, which is an idea for the Patient and Family Centered Care Committee. This is an example, actually, it's a really great example, and I'm hoping that we can get this established this year. It's an example of a project that could be new. So this applicant wrote about something that she saw locally at her IR institution, and she proposed a new idea that wasn't on the website. And so it just goes to show you that we're very open to different ideas. Like it can be an idea that's an expansion or a new idea. What I really liked about this idea is that she kind of talked about, she presented the idea, but then she talked about how she would execute it and where she could see it in the future, which is a very thorough and thought out question. And so it was a very strong applicant to me. Okay. And next slide. So I really want to thank you all for attending, and of course we'll go through the questions briefly. I know we're over time, so I do appreciate you all for your patience. I do want to say for the council that if you guys have any questions whatsoever, just about the applications or about just being interested in IR and how to get more involved, please feel free to contact us at sirstudents@gmail.com. As well, a lot of the chairs and I will be at the annual meeting in LA. So if you are in LA, just feel free to come talk to us. We're here for you, and we want to help you guys figure out if this is the right specialty for you and how to get involved and how to go about, being a competitive applicant. I can definitely say, just for a plug for the council, that it was a really great experience. I had no intention of becoming the chair. Actually, I applied as a second year, and I was just very interested in IR and very enthusiastic about it. And through these 3 years, I really learned a lot about myself and learned a lot professionally and grew a lot as a leader. And I think that is something that's really going to help me in the long run in terms of residency and beyond. And also giving back to you guys, the future, to future medical students, so that hopefully you guys can get more involved and find something that you're really passionate about, and then give back to people beyond that. So with that being said, we're going to go through a few of the questions right now if you guys have questions, and I'll let Lauren, if you have any final words.
Oh, no, thank you, Rebecca, for all your hard work this year and also giving that wonderful advice for the application. I want to thank everyone for attending. We will take a couple of questions just because we're running out of time. Unfortunately, let me try this.
Oh, I'll just do this one question right now. I'm just going to answer it out loud, if that's okay. So for the education committee, are you still making chapters for the Intro to IR series, and is something a committee member could take a part in doing? So the Intro to IR series is actually completed, but what you could do is, as Sana had mentioned, there are the introductory lecture series on that they're going to be doing with different topics for preclinical year, and that could be something that a committee member could be taking part in. But another thing is, if you are interested in doing something with the Intro to IR, definitely take a look at the series, and you could propose an idea to expand on it.
And I think I can kind of see the question. This webinar will be recorded and uploaded on YouTube as well.
Okay, awesome. I don't think there's any more questions, but definitely if you guys have questions like from now until March or even after, feel free to, again, contact us at sirstudents@gmail.com. And feel free to talk to us at the annual meeting. We're all chatty. I might be more chatty than other people, but and we'll be happy to help you guys through the process. Awesome.
Great.
Thank you all so much.
And make sure to follow us on social media. Thank you all for tuning in for tonight's webinar. Special thanks to Rebecca, of course, for really advocating for this business meeting and all your hard work this past year, and all of the chairs who worked really hard to prepare for tonight's presentation. Good night, everyone.